Today we are going to talk about one of our patients who's a 1.5-year-old baby who developed jaundice at the age of day 2 and which progressively worsened. She was extensively evaluated at a hospital in Iraq and was found out that her liver is not working well, and there is a disease in which the bile does not produce in liver and it does not go into the intestine. And she was advised a surgery at the age of 4 weeks, but that facility was not available, so that surgery was not done, and gradually her liver started to fail and she developed cirrhosis, stopped gaining weight, and at the age of 1.5 years when she came to us, she was unable to eat. She was just 6 kgs, unable to walk, and the growth was stunted. We extensively evaluated and we found out that other than liver, she has mild deformity in her heart as well. So we managed her heart pressures and then evaluated her for liver transplant and found out that if we do liver transplant, she can survive well. Then the question was who was going to donate liver. So both the parents were actually ready to donate liver. So we evaluated mother as a potential donor, and which was found to be fit, and so we accepted her as a donor. Now the situation which came to us was the baby was small, and the part of the liver which we were planning to take, which is a part of the left lobe of the liver, was significantly big for the baby. So in this situation, in these kind of situations, what we do is we reduce the size of the liver graft by splitting it at various levels, which is technically very complicated procedure. So in this one, we decided to take a hyper-reduced liver graft, and even with that, we knew that we will not be able to close the belly in one go. So we planned a 2-stage procedure. On the first procedure, we did the liver transplant during a hyper-reduced liver segment, which is we divided the liver, took the left lateral part and further divided and implanted that liver in the baby's body. On that day, we were unable to close the belly. So 5 days later, gradually, as the swelling subsided, as the liver adapted to the body, we gradually closed the abdominal wall. And after that, the baby recovered well.
السلام عليكم ورحمة الله وبركاته. والد الطفلة المريضة فاطمة من العراق من محافظة بابل. عندما أتينا بهذه الطفلة إلى هنا لم تكن حالتها هكذا جيدة، ولكن بعد إجراء العملية عن طريق الدكتور أباديب أصبحت حالتها جيدة جدا، والآن هي بحالة جيدة. وكانت الأعراض قبل المرض العيون ليس كذلك وحالتها سيئة، ولكن بعد العملية أصبحت حالتها جيدة جدا. ونشكر الدكتور ونشكر المستشفى على هذه الإجراءات الجيدة.
بسم الله الرحمن الرحيم. أنا والدة الطفلة فاطمة علي عبد الأمير. جئت من العراق إلى دولة الهند لعلاجها، وكانت في صحة غير جيدة، تشكو من تضخم في الكبد مع نزف دموي. وقام بعض الدكاترة في الهند بإجراء عملية زرع الكبد، وتبرعت لها بجزء صغير من الكبد، والآن هي بصحة جيدة جدا.
मैं नोमान हिम्मत बेबी फातिमा का इंटरप्रेटर हूँ। ये लोग इराक से आए हुए हैं, बाबल स्टेट से। इन्होंने अपने बच्चे की सर्जरी कराई है लीवर ट्रांसप्लांट की डॉक्टर अभिदीप के द्वारा। सर्जरी से पहले इनके बच्चे में जो सिम्टम्स थे उसको काफ़ी परेशानियां थी, वोमिटिंग, ब्लीडिंग, इचिंग, और कुछ भी खाती थी बच्ची उसको जो है हज़म नहीं होता था और काफ़ी परेशानियां थी। इन्होंने वहाँ पे बहुत से डॉक्टर्स को दिखाया, लेकिन वो ठीक नहीं हुई। किसी डॉक्टर ने उनको एडवाइस किया इंडिया के लिए, वो इंडिया आए और उन्होंने यहाँ हमारे यहाँ आकर के डॉक्टर जेपी हॉस्पिटल में डॉक्टर अभिदीप से सर्जरी कराई। लीवर ट्रांसप्लांट के बाद ये बच्ची बहुत ही नॉर्मल और बहुत ही फिट है, और हम शुक्रिया अदा करना चाहते हैं जेपी हॉस्पिटल का, उसके सारे स्टाफ का, और ख़ास तौर से अपने डॉक्टर अभिदीप और इनके स्टाफ का कि उन्होंने इस बच्ची को एक तरीके से दोबारा जन्म दिया, और ये लोग सारे लोग बहुत खुश हैं और आप लोगों का शुक्रिया अदा करते हैं।
Right now she is recovering very well and she is able to take a full normal diet. and activity-wise she's also recovering very well. And these are the kind of cases which are technically very complicated and challenging and requires a lot of expertise. We handle these kind of cases very much regularly. These kind of pediatric transplants where these kind of technical challenges keep coming up, and we are, as a team, we are able to handle these kind of procedures very well. So other than these kind of patients, we do other pediatric transplants, blood group mismatch transplants, all kind of adult liver transplants and liver surgeries in our unit. Our hospital is equipped with all kind of facilities to deal with any and every kind of liver related problems. So we get patients not just from India but around 40 countries in the world, and we do all kind of liver related procedures for them successfully. So this baby, as I said, is recovering well and soon will be ready to go back to Iraq and have a normal healthy life in future. Thank you.